Health and Human Services Committee of the Marathon County Board to order. Item 2 would be public comment. We do have one person that is registered, and that's Amy Litzer of 500 Grand Avenue. Amy, the floor is yours. Please limit your comments to 3 minutes if you could. Thank you. Is her mic open?
She's on mute. Amy, you're going to have to unmute yourself.
Okay, got it.
There you go.
I got it. I was working this morning and I was scrolling through Facebook. As I noticed in my events calendar, there are 33 to 40 mass gatherings that I find in Marathon County. But then when I recollected my thoughts, I noticed there are over 90 to 100 cases that have been happening in Marathon County, and I'm wondering, how could this be? But it's reality. It's because people can't stop gathering, won't get their COVID shots, always have an excuse to get out of it, always want to go shopping, always want to be out and about. But we have to get this under control. I was just hoping that our county or the board or our city could get together and fight with our fellow Estonians to get this COVID-19 under control. We have to work together. This isn't about one person. This is about the community. And if we don't work together, we're going to be in for one uphill climb, and we got to do this together. It's one community for all or not for anything at all. It's basically COVID in for the year, and we got to figure out how to deal with this pandemic. Thank you.
Okay. And thank you, Amy, for your comments. Are there any other members of the public out there that would like to make a comment at this time? Okay, thank you. We will move on to item 3 then, approval of the June 2nd, 2021 HHS committee meeting minutes. Those were sent out in advance. Are there any additions or corrections to the minutes? Okay, seeing none, and a motion would be in order to approve. Okay, I have a motion from Supervisor Krause and a second from Supervisor Van Cray. Any additions or corrections? Seeing none, all in favor say aye. Aye.
Aye.
All right, opposed? Motion carried. Thank you. Item 4 is policy issues, discussion, and potential committee determination. We don't have anything under that heading today, so move on to item 5. Operational functions required by statute, ordinance, or resolution. 5A is a request to the county board to abolish vacant 1.0 full-time equivalent administrative assistant position and expand the 0.5 FTE social service specialist to 1.0 full-time equivalent. Lance, or you or Vicki handling that one?
I think Julia is on today.
Julia.
And Julia, can you hear us?
Yes, I can hear you.
Very good. So would you care to?
So I appreciate, oh,
Go ahead. Go ahead. Just care to explain what we're trying to get accomplished here today.
All right. I appreciate everyone's time. During the course of the pandemic, we have been able to educate our customers about many of our services being available telephonically and electronically. This has resulted in less customer foot traffic coming into our building at social services. With a vacant position at our front desk team and the 2 vacancies that we have on our general access team, management has evaluated staffing needs, and we're recommending to reduce the 1.0 FTE administrative assistant position on the front desk team and increase one of the social service specialist position on our general access team from 0.5 to 1.0 FTE. This restructuring, it will better align staffing to meet our customer needs and support services for families, and it will result in a net levy decrease of $21,796.
Okay.
Are there any questions?
Any questions from anyone on the committee regarding that proposal? Yeah, go ahead.
Just to provide a little context, thank you, Julia, great job. So the reason, and this is before you, this might sound like, and it is, a no-brainer, right? Why aren't we doing this? We can align our staff to meet the work needs. It's more efficient and it's saving the county money. Your current ordinances require any new position or expanded position to go through a standard process, and that's laid out in section 4.20 of the Marathon County Code of Ordinances. And that process requires that any new or expanded position to take effect during a calendar year must both be approved first by the administrator, second by any standing committee, that in this instance is you. And then also it needs to go before the HR, Finance, and Property Committee in accordance with, again, 4.20, which prescribes that those positions be brought before that committee in groups in either March or August. So, as you'd likely guess, that's why it's here in August. Credit to social services and the team for when they have a vacancy, and that's what really led to this. When we have vacancies, we look to the ability to restructure, and there's been a couple of vacancies within social services where they're able to, Julia and her team were able to assess what's the best way to get the work done and what specific positions do we need, and that's why this request is before you. So I wholeheartedly endorse this what I'll call mini reorganization within the social services administrative division or administrative team, which would then be moved forward to HR, Finance, and Property, and it would take impact as soon as adopted by the full board at your August meeting.
Okay.
And everything is in the packet if you did have any questions or concerns about any of that information. So I don't know, Julia, if I left anything out.
You did a fabulous job, Lance. Thank you.
All right. Any questions or comments from the committee? If none, then a motion to approve this and move it forward to finance would be appropriate.
This is Supervisor Harris. I'll make a first motion to approve.
Okay, I have a motion from Supervisor Harris, a second from Supervisor Krause to approve item 5B, request the county board to abolish the vacant 1.0 full-time equivalent administrative assistant position and expand the 0.5 FTE social service specialist to 1.0 FTE. Any further discussion? Seeing none, all in favor say aye. Aye.
Aye.
Opposed? Motion is carried. Thank you. Item 5B then is a 2022 budget position request, and B1 is two 1.0 full-time equivalent social workers categorized as C42 for the Children's Long-Term Support Program. Julie or Julia?
I think I'll start and then I'll tee it up for whoever from social services is going to run with it. So again, just for context, during the budget process, any new position requests are first considered by county administration. And the process historically had and also involved, and it still continues to involve, the standing committee again with respect to social services. That's this committee. And then ultimately it gets any new positions are built into the administrator's budget, provided he or she can identify funding. So the reason the positions are before you today is Vicki brought these new position requests to me, similar to the previous positions. These aren't quite as good, but they're good. They don't cost any additional tax levy. So these are new position requests to fill clear need relative to the Children's Long-Term Support Program to work off the wait list. I will build those positions into the 2022 budget based on, again, my approval that they are appropriate and necessary and a clear source of funding, namely reimbursement. Then They will, after, provided you approve them today, I will present them to the HR Finance and Property Committee along with all the other new position requests that I've received thus far through the year for consideration in the budget. I'm not going to ask the HR Finance and Property Committee to approve the new position requests at that time, but will, as I indicated before, build them into the 2022 budget, which will then be considered by the HR Finance and Property Committee before being formally adopted by the full board later this year. So that's the context on, again, why it's in front of you. And any specific questions about the positions themselves, I'll leave to the social service professionals.
Okay.
I don't know if Julia or Julie is going to take that. If anybody has any questions.
The only question I had, Lance, is you had mentioned that it's going to have no fiscal impact and you're going to clear some space. I mean, is there going to be impact elsewhere if in fact we do this, or?
Impact in what sense? There's certainly, I'll say this, anytime we add new positions, right, there is an increased overhead or administrative oversight. There is clearly impact there. But Julie or Julia, do you guys want to talk about how these positions work and how they're funded, just to give the committee a little bit more insight on the reimbursement?
Julie, you're on mute.
There we go.
Sorry, thank you.
Okay, thank you.
So these are funded by state and federal Medicaid dollars, essentially provides the funding for these programs. So we receive reimbursement through case management. We actually bill our case management, receive funding back for that when we're billing that out, and receive funding from the state in order to support the children. So we're working with a variety of children with various disabilities in order to keep them in the community, keep them safe, and provide them what they need. And yeah, these two positions would really help to support us to eliminate, our goal is to eliminate the waiting list for the children in these programs. So these two new positions would allow us to serve more children and meet the needs of more children. And there is no anticipated tax levy to support these positions, because we do bill that Medicaid for our case management services, and we do receive funding for the state through Medicaid.
One other thing I'll add, if I may, Mr. Chair, is, I think it's a very good question, and I'm sure I'm preempting someone's question here, but it's a very good question that the county board frequently asks about anytime we're talking about grant or reimbursement funding. What's the stability or sustainability of this funding look like? And I think that's, again, a very valid question. In my estimation, certainly no funding is absolutely guaranteed forever, but this is very stable, long-term funding. The state has made this a priority, as Julia referenced. Working off the wait list, addressing the wait list has been a frequent topic of discussion through DCF, Department of Children and Families, and at the state. So of all of the sources of funding that we have, this is in that kind of bucket where I would say it's very stable, and we shouldn't have significant concerns or reasonable concerns about its ongoing sustainability. Would you guys agree with that, Julia and Julie?
Yes, it's 100% funded. It's an awesome opportunity to take advantage of and to help our community members.
Okay. Any questions or comments for committee members? Supervisor Krause, go ahead. Bear with us till we find a microphone that works.
Yes, just out of curiosity, and because this is a Health and Human Services Committee, I have some questions as to the children and their disabilities. I'm just curious to know how many children with disabilities you do serve, and if you list or categorize the types of disabilities. And if you do, are you able to mention what the major number of disabilities are, like number 1, number 2, number 3? Thank you.
Are they muted?
I don't know if you guys have specific information, but I can say within the
I
packet,
don't,
there is reference to, currently the Social Services Department does have 14, and please correct me if I'm wrong, Julie or Julia, 14 full-time social workers providing those case management services to 306 children who are enrolled in the Children's Long-Term Support Program. And there was an average between 2018 and 2020, an average of 112 new children's long-term support applications received every year. So of those, 80 or 71% were found to be eligible. So there's significant need within the community and growing need. And it's a significant workload for those social workers. Do you want to talk, Julie or Julia, just briefly on what some of the challenges that the children in this program and the families in this program face on a daily basis?
absolutely. So we're serving children that have both, they could have physical limitations, they could have mental health challenges. So each child is so very different. And I don't have the numbers as to categories, who is the top priority, but we do serve a variety of children. And, these are children that are very difficult to manage. And so the families are looking for a lot of support in order to best serve them. So they might be looking for respite care in order to give that caregiver a break, so that they can come back refreshed and kind of come back able to meet the child's needs. We're doing different things with potentially home modifications for those children with physical disabilities. So we do a variety of services based on the child's needs and the outcomes that we have for that particular child. But we do serve a variety of children with various disabilities, including things such as Down syndrome, cerebral palsy, autism. So it's kind of a variety of various diagnoses that we might touch and families we might serve.
Okay. Oh, Supervisor Krause, go
I
ahead.
have a follow-up question. It would be interesting, or comment, it would be interesting to know what, what kinds of disabilities and the numbers. It would be interesting to know that, to see if any particular disabilities has increased enormously over a 5-year period, 2-year period, 10-year period, such as childhood cancer or autism. And I don't know if very many children now are getting COVID and have issues, with disabilities with that in the county or not. But it would be interesting to know, just from a health standpoint. Thank you.
Okay. Thank you for your input, and I don't know if there's anybody needs a comment on that necessarily, but that is a consideration. So, any other comments from any of the other committee members? All right, seeing none, a motion would be in order then to accept the proposal to bring in two 1.0 full-time social workers for the Children's Long-Term Support Program. Okay, we have a motion.
Supervisor Gonring, I make a motion.
Okay, Supervisor Van Craig gets the motion and Supervisor Gonring with the second. Any further discussion? Seeing none, all in favor say aye. Aye.
Aye.
Opposed? Motion carried, and this will be forwarded then on to HR Finance and the Property Committee, so thank you for that. All right. On to item 6 then, educational presentations and committee discussion. 6A is an update on the Start Right program. This is something that, for those of you that are new to the county board, this is something that has come up numerous times when budget time comes around as a place to perhaps make some cuts. And this usually comes down to our committee showing, and Joan Toyer showing the need, the purpose of the program, and why it's important for Marathon County. So Joan's with us today to kind of give us an update and where we're at on start rate. So Joan, floor is yours.
Thank you, Chair Butke. Tasha, can you pull up the PowerPoint? Thank you. Okay. If you could just, yeah. What you're seeing right now is an overview of the program impacts for 2019. So if you could just toggle in, I think the PowerPoint is after that, those documents. Okay, thank you. That's perfect. And so Tasha, what I'll just do is prompt you when I'm ready to have you move onto a new slide. So as you can see, it is not June 30th, 2021. This was prepared for the last Health and Human Services meeting that was canceled. So the information is still relevant, and I forgot to change the date, so I apologize for that. The task really that I was given with was to provide an update on the Start Right program evaluation, and I'll get into that in a few minutes. But I thought what was probably more important at this point in time, given we still don't have anything in writing from the evaluation process that is underway, is to provide an overview of the program, giving the varying levels of understanding of the program, in an effort to ensure that everybody's grounded in what Start Right is and what its purpose is. Tasha, if you could move to the next slide. Thank you. So as a community, I think we would all agree that we want to support parents to be the best parent they can be. And since 1994, Marathon County has been making investments to attain these goals through the Start Right program. And Marathon County Start Right program has been contributing to what I would see as 4 broad goals. The first one has to do with, we all, I think, could agree that we want our children to experiencing nurturing relationship with their parents. And we do this by preventing or reducing the number of adverse childhood experiences that include child abuse and neglect. Another common goal we have for our children in Marathon County is that children are healthy. And we do this by lowering the percentage of low birth weight babies, ensuring children have a medical home and are up to date on their vaccinations, and have adequate food. The third goal, I think we would all agree that we have common in terms of children and their outcomes, is that children are safe in their homes. And we do this by preventing infant deaths due to unsafe sleep environments, preventing childhood injuries and deaths due to safety hazards in the home. And our last goal is we want children to be ready and successful when they begin school. And so we do this by reducing the number of children who are needing early intervention services once they enter school. Start Right, in a sense, acknowledges that a segment of our parents need and benefit from supports to be the best parent they can be. And this can be for a variety of circumstances due to things like alcohol and other drug misuse, domestic violence, depression, or a diagnosis of mental illness, history of abuse, being cognitively challenged, being single, a teen, having less than 12 years of education, English as a second language, and first-time birth. Tasha, if you could move to the next slide. So Start Right program services are guided by standards set forth by state and national programs that guide home visiting programs of this nature. And there are basically 3 main components to Start Right at this point in time. The first one is called First Steps, and services are for women who are at risk for a poor birth outcome. And our services are guided by Wisconsin Medicaid Prenatal Care Coordination Program standards. And they basically, in those standards, talk about the frequency of the visits. They talk about what health education topics are to be covered and what information and referral services are we to assure for every woman that's enrolled in the program. From there, then, we know that there's a segment of families who could benefit then from ongoing support once that child is born. And so children then and their families are referred to a program called Step by Step, which is a program that provides national parent education, parent support, information, and referral services. These services are accredited by an organization called Healthy Families of America, and it's a national accreditation body that sets standards for home visiting services. And then we also have another service called Stepping Out, which is about assuring that every parent who has a child in Marathon County has access to information and resources. The other two programs, we do have eligibility standards in place. Stepping Out Family Resources is really meant for anybody who would like additional parenting information, as well as providing what's called a Play and Learn, which is basically promoting how parents can interact with their child to promote their development. In addition, through a contract with Children's Service Society, which is part of Children's Hospital, they have a warm line support where basically they can call in 24/7 and there's a trained person to answer questions, or if a parent is feeling like they're in a crisis, out of control, somebody they can talk to and talk them down. So overall, and this is based upon our priority-based budgeting numbers from 2019, which includes not only our supervision, but our health department's indirect costs. So when you think about indirect costs, it's my time that may not be really to start right, but we have to allocate it to programs. It's also our fiscal, it's our reception. So it's our general operations that make this department basically be able to carry on all the services it does. So those services get divided across all our programs. And it's estimated that it's about a $1.151 million, a little over $1 million that's being invested in terms of tax levy. And then there's a little over 400,000 where we receive additional funds through grants, foundations, as well as Medicaid billing. Next slide, Tasha. Is there one before that? I'm sorry. Can you go back one? Yep, there we go. Thank you. So as Chair Butke stated, this is a program that for the last several years, when it comes to the budget process and budget time, there's the question that's raised, how do we know that Marathon County's investments are contributing to the outcomes we aspire for our children and their families? And better yet, is our investment paying off? And it's a great question that is asked on an annual basis. And how we've responded in the past is one way we know is based upon prior program research that was done for both program components. So Tasha, next slide. Thank you. So we were fortunate as a county to actually have both programs where the participants and the data that was collected on that was part of a statewide study, statewide research. When you look at the dates, the first thing you're going to say is, well, that was a long time ago, and it was a long time ago. But the premise of this is that if we carry out what those best practice standards are, that we should achieve the same outcomes. So a research study was done in 2010, and it looked at Wisconsin Medicaid Prenatal Care Coordination Program, which is the program that Marathon County Health Department, our public health nurses carry out with women who are at risk for a poor birth outcome. And Marathon County was part of that study. And so what you can see is that the study demonstrated that there was fewer low birth weight infants, fewer very low birth weight infants, and fewer infants transferred to the neonatal intensive care units. And so you might say, why would we care about that in terms of fiscal impact on the county? Well, we know that long-term babies born healthy are less likely to have motor or social development delays. They're less likely to need early intervention services such as birth to 3, have learning disabilities that require educational, job, and housing support services. The other study that was done in 2003, and that was back when home visiting programs that is carried out through Children's that provides parent education, parent support, as well as information and referral services, was a pilot for the state of Wisconsin Department of Health and Family Services. We were one of 10 counties who were participating in that pilot, and they wanted to basically assure themselves that the investments that were being made were paying off. And so you can see that the impacts that were realized was a 25% reduction in child abuse and neglect cases among first-time parents who were at risk for child abuse and neglect, 25% less out-of-home placements. Emergency rooms were less than half of other Medicaid children 0 to 5, and 87% of children were up to date on immunizations compared to 54% of Medicaid eligible 2-year-olds. So they actually were able to do comparison of the children and their families participating in the pilots in these 10 counties compared to the state children who were enrolled in Medicaid not participating. In your packet and what was highlighted before we got to the slides are the outcomes that we do track, and they are keeping with state and national program standards. I would say about every 3 to 4 years, we sit around a table with our partners from Children and review what those outcomes are, and to ensure that we are looking at the kinds of outcomes we should be given what we know about the success and the research around these 2 major programs. In recent years as well, economists have begun to weigh in on the benefits in investing in families with young children, and they've been actually looking at long-term impacts in having babies born healthy and reducing adverse childhood experiences. And I think, too, in the last 10 to 15 years, we have all increased our understanding of what the impacts long-term, short-term as well as long-term impacts can be when a child is experiencing adverse experiences such as child abuse and neglect. I'm just trying to think, a parent who may be misusing substance, a parent who may be struggling with depression or mental illness. And we know that children who do experience adverse childhood experiences are more likely than to need ongoing support once they become adult, which then can impact our taxes in terms of special education, supporting our justice system, healthcare costs associated with alcohol and other drug misuse, abuse, as well as mental health and chronic diseases. So given the fiscal constraints and the fact that Start Right is not a mandatory county service, the question that continues to surface at budget time is what is the county's investment of a little over 1.1 million actually buying? Tasha, next slide. So to try to answer that question, an application was made to University program, which is part of the UW system, in December of 2020. And it was with the purpose of having an outside entity take a look at the program. We applied, as you can see, in December of 2020. I first met with the managing director, a gentleman by the name of Gavin Luther, in February. And his job then is basically to look within their UW system to see who has the skill, the expertise, and the time and the interests to carry out the task at hand. A match was made on April 21st. 2020. It is with an individual who is semi-retired and has a strong background in program evaluation and public policy. So at this point in time, between April 21st and as of today, what has been occurring is Barry Dellin, who is the professor, has basically been collecting and obtaining information and data from us for him to take a look at and to basically evaluate. I would say at this point in time, some of the limitations that he is dealing with is, first off, I think the time frame is very aggressive to do the kind of program evaluation we're asking from basically the months of May till mid-September. Secondly, another limitation is he can only work with the data that's available. And his goal really is to compare the population we serve and the outcomes we see with a comparable population of families who are predominantly on Medicaid with the same kind of income level and same kind of experiences. So that in itself is going to be challenging. I would say some of the benefits associated with this is we definitely will be finding areas that we can improve and strengthen. There's already a couple data points that he's asked for that we don't readily collect that would strengthen our ability to talk about the impact of this program. So at this point in time, findings are planned to be shared by mid-September. And we've talked a little bit, Barry and myself, around, are we looking at cost benefit versus return on investment? And I think those are a really good point that we need to understand. When we talk about cost benefit, it's basically an accounting principle, and it's used by county government, and it basically said, did I get back what I invested in? Whereas return on investment looks beyond county government, and it's really looking at societal benefits and how are we bringing down societal cost associated with short-term impacts of not addressing the problem. So it gets back to, if we're talking about we want babies to be born healthy, it may not have an immediate cost to the county, but it will probably have a long-term cost. Also, by having babies born healthy, we're contributing to them being more likely to be contributing members in our society. And again, those are concepts that are more related to return on investment than this concept of cost benefit. So I thought that was an important point of discussion with Barry, and that I wanted to share that with you And when I do receive the draft, I will be reviewing it and looking to make sure that is highlighted and addressed within the report. So with that, I just have one closing slide that is quoted from an economist, but it's summarized this idea of return on investment, that investments prior to kindergarten, especially for children considered at risk because of poverty, abuse, neglect, parent chemical dependency, among other factors, can have substantial impact on the sorts of students, workers, and citizens the children eventually become. So with that, I will conclude and open it up for any questions that you may have. Thank you.
Very good. Thank you, Joan. Being a banker, I especially appreciate your discussion on return on investment. I understand that language, so I do appreciate
Well, that's
that.
good. I should have had you define the differences because I never really gotten a tutorial on that.
All right. I would open it up to our committee. Supervisor Krause has her hand in the air. Go ahead.
Thank you, Chair Butke. I was just wondering if, like, parents who have addiction problems, whether it's drugs or alcohol or anything, does this program insist that they get treatment and stay in some type of remediation and improvement program in order to get the assistance from the Start Right program?
Yeah, actually, that is one of the outcomes we do track is we do assess for substance use and also whether or not a parent could benefit from mental health services. And we definitely strongly encourage, we help share information, help link them. Sometimes we've been known to accompany them to an appointment, but it is not a condition of service because as you may know or experience yourself, sometimes it takes several attempts, several kind of what you might call intervention discussions before people are ready to receive those services.
Other questions? Does that answer your question? Okay. Are there other questions from committee members? All right. Yeah, Lance, go ahead.
Thank you, Joan. Joan did a great job. I just wanted to, as Joan alluded to, kind of provide additional, perhaps nationwide context. You've likely read your National Association of Counties magazine and newsletter that you get, so this won't be a surprise to you, but the idea of prenatal to 3 and beyond in terms of the sort of programs that Joan is referencing, that when we talk about Start Right, what we mean, this is a big focus through the National Association of Counties. I had the pleasure to attend a National Association of Counties conference a couple of weeks ago in Washington, D.C., and I attended a presentation on this very topic and all the things that they were talking about being innovative and, whether it's prenatal to 3 and the idea of how do you integrate parental education and home visiting programs, how do you bring those into your community? Those are the things we've been doing for numerous years, and other counties are looking to do similar things. So I appreciate, as Joan laid out, we need to have a good contemplation of how do we really assess value to all of our programs, and priority-based budgeting is a tool we talk about. And I think Joan did a great job when you talk about, how do we assess really the benefit of a program? Is it simply, if we simply look at cost recovery, this program is, we don't take in revenues from this. We do have some partners that offset the cost of the program. We partner with Children's and others, other health systems, which is a great thing to minimize total overall cost. But in terms of cost recovery, it's not great. But if you change that narrative, like Joan said, and you start looking at things like cost avoidance, direct cost avoidance to the county, like Joan talked about, if we broaden our time frame and we look at, okay, what is this, how can we improve the experience for that child from birth to 3 and beyond, those lifelong outcomes of, fewer ACEs means fewer adverse adult experiences. We have fewer people who are incarcerated, fewer children who are making their way through the social services system. All those things cost money. And then if you expand that beyond to an idea of what is the community or societal benefit, it is exceptionally large, using that economic data that Joan referenced. So really, I'm interested to see what we get from the UW and their program, and we'll certainly report that back to you. But this is all in keeping with the board's directive in 2020 to try to get a handle on how do we assess program value, and the university program is helping us in that. So I wanted to say thank you to Joan for her efforts to get that done in the midst of everything else that has been going on at the health department for the last 18 months.
Yes,
Thank you.
I concur. Thank you very much. Any other discussion from committee members? So hang on to this presentation, because I can assure you we're going to need talking points as we go through the budget process in the next few months. So it'll be important. So with that, I will move on to item 6B, which is the health officer announcement. It looks like Lance is going to take that, and we have
Yes,
yeah,
I
go ahead.
will. I ended my last comments by thanking Joan, and she's still on, so I'm going to begin my comments here by thanking Joan. Joan has done, not only the last 18 months, which is the time that I've been serving as administrator and working through the pandemic. Joan has done an exceptional job for us since she came here in 2006 to be the director of our family health and communicable disease program. She became health officer in 2009, has walked us through 2 pandemics. This one is a little bit has been more of a challenge than the previous, but nevertheless, those are the things that everyone reads about. But as you just heard about Start Right, there's a lot of work that happens every single day at the health department that people don't appreciate. One little example that's not so little is all the work that they did for a decade around preventing people from smoking prevention and abstention work, which if you think back to where we were a decade ago with tobacco usage, it's really quite remarkable when you look at the progress that public health has made in our community. Joan's been a big part of that. So it's been a pleasure to work with Joan, and as you all know, people don't stay working for the county forever, even though I'd like to keep them there. And Joan is no exception to that. She's put in a great deal of effort, not only here, but also at the state level and elsewhere throughout the state of Wisconsin. So Joan is moving on to other things, baking being one of them, and vacations. Her last day with Marathon County is going to be September 1st, and I'm sure she's going to fill her day with all things she's enjoyed over her life. But certainly for the last 18 months, those things have taken a backseat to other priorities at work, which I greatly appreciate, and I know our community does as well. So I wanted, unless, Joan, do you have anything else to talk about before? Otherwise, I'll jump into the process, but the floor can be yours.
No, I would just say that, and you'll get to read about this, that, some of you have heard this already. I came to Marathon County when I wanted to kind of return back to making an impact at a local level. I started working in public health at a local level, and from there went to tribe, went to city, and in county, then went to the state. And I was at a point where I was wanting to make an impact at a local level again. And I chose Marathon County because of the nature of the county and its value around partnership, which is huge in order for me to be successful, for our department and the teams I work with to be successful. So I just want to call that out because each of you also contribute to that great working environment that we have here. So thank you for your past and ongoing support. And I expect it, even though I won't be in this chair, I'll be still watching to ensure that it happens going forward. Thank you.
Thank you, Joan. See, that's enough motivation for me. Joan's going to be watching. So moving forward, I think Joan really teed me up nicely for this next next series of comments I'm going to make. I've talked with the board before about department head appointments and the process that I go through, the typical process. But as I've said many times over the last 18 months, the health officer is special, and the state statutes recognize that. So unlike the other department head appointments that I have told you about, and recently I announced, for example, Corporation Counsel, where that is an administrator decision in Marathon County. The board has vested me with the authority to go through the process, lead the process, select the individual, and hire that individual to be a member of the county team to assist the board in moving forward with policy. The state statutes relative to the health officer recognize that this is really an important position, and they do that in one important way. Whereas other department head positions, you as the board have the authority to vest in me, your administrator, the authority to hire that department head without bringing that appointment back to you for confirmation. The health officer, for all the reasons Joan referenced, primarily this idea of partnership and community partnership, it requires confirmation by the county board. So I wanted to take a couple of minutes to tell you about the process. Again, the administrator still makes the appointment, but it's subject to confirmation. I want to talk to you about the process that we went through when Joan informed us that she would be moving on her last day, September 1st. How did we ensure that we got the best candidate, not only to bring to the board, but also to serve the people of Marathon County? So if I could indulge you just for a couple of minutes, how we approach that. We first reviewed that job description and we tried to highlight all the things that Joan referenced. Really this idea that the health officer is a representative of the community and they move public health forward with the community, not upon it. And we did that through the job description. We posted that job for over 4 weeks. We did a nationwide recruitment to ensure that we were able to draw talent from everywhere and anywhere, and we did receive a number of applications. I recall reviewing applications from individual from New York State. So we wanted to make sure we cast a very wide net. But also, again, hitting all of the things that Joan referenced, really trying to impress upon applicants the need to demonstrate those skills in leadership, those skills in partnership. We also engaged the State of Wisconsin Department of Health Services. State statutes are pretty clear on what, in fact, very clear on what a candidate for a level 3 health department health officer must have in terms of background and experience, and we wanted to make sure that we continued the tradition that Joan has set of being that high-performing health department. So we engaged the Department of Health Services to help us screen initial candidates, and then also at the end of the process, we wanted to work with them again, and we did work with them again to make sure that we were highly confident that the candidate we were moving forward to the county board met all of the criteria that the state statutes lay out. We then after we were able to screen the candidates, we did a 2-step interview process. So we convened 2 separate panels. The first panel was to get the input from the Board of Health. As you know, the health officer works very closely with the Board of Health. Again, a committee that is set forth in Wisconsin statutes and your local ordinances in terms of membership and duty and responsibility. So we engaged the chair of the Board of Health, John Robinson, who also serves on the county board, of course, Koo Her, a medical professional who also serves on the Board of Health. And then we had a couple of our internal HR staff specialists sit in on those interviews to provide some outside perspective and assist in the interview process. So that was the first round of interviews. The second round of interviews, really again to highlight that importance of partnership. That panel was comprised of our Employee Resources Director, Molly Adzik, Jeff Sargent, the Executive Director of the United Way, and Tara Drager from Aspirus, who actually wears a couple of different hats in our community, a number of hats, many of which Joan, in her capacity, Joan works with Tara on a number of different things. So, and myself, I was on that panel as well. So that was the second interview that took place. And at the conclusion of that interview process, we also did reference checks. The individual we selected, and her materials are in your packet, and I'll announce her name in just a moment, but we conducted reference checks. And throughout this entire process, it became very clear that, as Joan referenced, people choose to come to Marathon County because of our longstanding history of excellence, our tradition of excellence. And it's not surprising to me at all that the individual that we have selected to succeed Joan in the role of health officer is an internal candidate. That candidate is Laura Scadari. She came to Marathon County in 2020 to work as a public health educator, but her ties to our community and her contributions to the community are longstanding. She has she worked at Bridge Community Clinic, served as the director there, and again, her resume is in your packet. Bridge Community Clinic, served at North Central Healthcare. She's been a public health educator since 2020. She would have succeeded and has succeeded Judy Burrows as the Community Health Improvement Officer in Marathon County, or director, I should say, in Marathon County. However, she's also now selected to take on Joan's role, so we'll be filling Laura's previous position. But she really separated herself from all other candidates for the position. Her references were really both internal and external. Her strongest references in the community were from law enforcement, both at the city and the county. She led some projects before her time at North Central Healthcare to help the county and city and North Central Healthcare improve their crisis diversion practices to better provide mental health services to people in our community. She had references from our local health systems. I talk a lot about at the county that we hire for character and we train for skills. This is really a home run. She's got character and skills. I am really excited about Laura Scadari coming into that role. She has that leadership experience. Joan's shoes are going to be big. They're going to be big to fill, and I think the process that we utilized set us up with the greatest likelihood of success to get a highly qualified candidate, and I think we were able to do that. And I'm going to be proud to move Laura Scadari forward for appointment and consideration by the board at your next meeting. So with that, I'd be happy to answer any questions you may have.
Very good. Could I just make a wholehearted endorsement? First off, I mean, I've had the privilege of knowing Laura for a while. My wife is also a healthcare professional, a family physician, and has had the privilege of working with Laura on a few boards, and she will bring a lot to the table, professionally and otherwise. So appreciate that, and I think she's an excellent choice. But any other questions or comments from the board? All right. Well, very good, Lance. And
Thank you very much for your time.
yeah, all right. We will move on then to item 7, the next meeting time, location announcements, and agenda items. 7A is committee members are asked to bring ideas for future discussion. One thing, if Joan, if you're still with us, I want to hit you up for one more thing, because our COVID numbers have been ratcheting up, and I just wanted your thoughts just for a second, because I know like the health committee meeting, you're kind of rolling back the meeting in person thing, or at least making sure there's distance and masks. What are your thoughts? Do you have a recommendation as we go forward here at the county level?
Oh, in terms of in-person meetings?
Right.
Is that the question?
Yeah.
Okay. I would say, we are at the point in the pandemic where we know a lot about what we can do to protect ourselves in terms of safety measures. And I think we've had the fortune of schools during the time they were opened last year to learn a lot about what works and what doesn't work. And I think the key is, first off, the 6-foot distancing, can't say enough about that, ensuring that occurs. Also, I would say that ventilation is important, and one way to control for that is just to reduce room occupancy for meetings. And then the third area is, at this point in time, we do have substantial community transmission, and in light of the Delta variant and it seemingly spreading more easily than any other variant, and we're seeing that a portion of people are able to be infected even though they're vaccinated. And I just want to also pause there, saying that they are protected from the vaccine in the sense that they are not less likely to get severely ill, hospitalized, or die. But the Delta variant is kind of changing the landscape a bit at this point in time. So as a result of that, CDC, the Department of Health Services, and I am now also recommending that when people are in indoor public settings, that they wear masks. So those are really the three key things, is just 6-foot distancing, reduce room occupancy, and encouraging people to mask.
Okay, very good, thank you.
And continuing to make an option open for people as what's doable, that they can join by virtual.
Virtually, right. Okay. Lance? Yeah, I understand. Yep. All right. Yep. Okay. Item 7B then. Our next scheduled meeting is September 1st, 2021 at 4 o'clock. Unfortunately, I'm going to be out of country, I think, depending on the COVID variant, and assuming my passport's coming back. My vice chair is also not going to be available for that meeting. So what I was wondering, is there a possibility of moving that either frontwards, backwards, or for Michelle and I did talk, and like the following week, is that soon enough? Like if we do it the following Wednesday on the 8th, or does that not work?
It works for Supervisor Seibert.
Okay, thank you. All right, Supervisor Krause says yes. I think Tosh is looking at the county calendar because it's September 8th, 4 o'clock.
Yeah, I think initially it'll work for me as well, Supervisor Harris.
Great, good.
Yeah.
right.
Supervisor Godwin is fine with me.
Appreciate that. All right. I think Tosh is still looking. She's nodding in the affirmative. All right, we think that'll work. We'll send out an email to confirm, all right? Supervisor Krause, yes.
Thank you, Chair. I have a suggestion, and I've just sort of been keeping my suggestions to myself and not contacting you or anything, but I wanted to bring up today a suggestion for a possible topic or something on the agenda for the future meetings. And that would be, there's a big push now to go into electric and battery run vehicles. The automotive industry is gearing up for that, and they're putting in, they even have robots now that will recharge the cars automatically, so the person doesn't even have to get out of their car to get their battery recharged or whatever. And I mean, most of the brand new vehicles are being purchased by people that have an income of over $100,000 a year. So that leaves a lot of people without being able to buy the new vehicles. And 1/3 of our carbon footprint is from the fossil fuels, coming out of the vehicles. diesel fuels from buses and trucks and cars and so on. Anyway, the impact that we're having that nobody really seems to be addressing in this community is the effects that the climate is having on us locally with flooding and rain in January and extreme ice storms like we had in February. Trees, my neighbor's trees fell over on their house. Hundreds of trees going down, houses being damaged. I would like to see something, where we're addressing what we can do more to negate the changes that are coming, to stall and move back. They're saying it's impossible to move back. We're moving forward, but we really need, they're talking 2030 to do these things, 2045. What can we do locally to minimize the effect it's going to have on people's health? A lot of people get depressed because of the financial cost involved, then the health costs, the damages and the injuries. So I'd like to see something addressed about that.
Okay, I appreciate your thoughts. It's a big topic that ultimately does affect health, so it does affect what we deal with in our committee, but that, that'd be something to consider for the future, certainly. Any other suggestions or discussion for today? Seeing none, a motion.
Supervisor Seibert,
Yes, go ahead.
I just have a question for Lance. Lance, with Joan's recommendations, is the county board going to go back to virtual voting meetings, or are they going to stay where they're at?
I'm not aware of any change, and I want to make sure we comply with open meetings. That topic really hasn't been agendized, so I don't want to discuss it further. But the short answer to your question, I'm not aware of any request to change your rules. Your rules were changed by the county board to require in person for your voting meeting at your last meeting.
Right. And I do apologize for but I just wanted to ask her, and I did not want that to come up for discussion, but I did want her opinion on where we stand, because that will be a topic of discussion in future meetings, I'm sure. So, all right. Seeing no further discussion, a motion to adjourn would be in order. I have a motion. I have a second. A motion by Supervisor Van Cray, second from Supervisor Krause. All in favor say aye. Aye. Oppose?
Aye.
Motion carried. Thank you and have a good evening.